Good afternoon, ladies and gentlemen who have joined us on the Dr. Fundi Health Channel via multiple social media platforms, Facebook, YouTube, Twitter, and the Dr. Fundi website. My name is Dr. Fundi Lenyati, and I'm the host on this channel. Today, I have a special guest, Dr. Lehlohonolo Makhakhe, who is a specialist dermatologist, who is a senior lecturer at the University of Free State, the health faculty, the medical school. He lectures students from the third year to the final year of undergraduate medicine. And he has recently soft launched a dermatology medical book on African skin conditions. Now, Ndate Ngaka Lehlohonolo.
Yes,
My understanding is that Lehlohonolo means blessings.
yes, it does.
So you are definitely a blessing to the people of Africa. You have come up with a book which has never been done before, a book that actually is an atlas of all skin conditions that affect people of this African continent. And for that, you definitely are a blessing. It will help not only patients, but it will help medical students, it will help GPs, it will help even specialists, in your field, as well as the quick reference, because there's pictures and then whatever. I'll hear more about that from you. But welcome to the Dr. Fundi channel, Doc.
Thank you very much, sir. And it's a pleasure to be here. And thank you for hosting me today.
Yeah. So, Doc, just to get this discussion going, you have had a lifelong goal to write a medical book that will focus on African skin conditions. And that dream has just been fulfilled. So can you just, maybe before we talk about that, tell us a little bit about what you do at this moment? I know you qualified in 2007. You did your internship, community service. You became a GP at a certain point, and right now you are actually an academic. Just tell us a little bit about what you do.
Okay, sir. Thank you very much. Firstly, good afternoon to everyone who's tuned in, and thank you so much for making time for this. I'd like to also take this opportunity to thank you as well as for hosting me. I think this is such a wonderful platform. First time I heard about this was when I actually got a call from Dr. Tabane, our pediatrician here in the Free State. And this is so exciting. I can just assure you now that I definitely will be tuning in much more often from this point moving onwards. So thank you very much. I think platforms such as these are extremely important to raise awareness and in the sense of unity as well moving forward. It will be very insensitive of me if I would not send my condolences to the Mandela family at a very unique and celebratory day for us, but for the Mandela family, that is not the case. So condolences to the Mandela family. Yes, sir, definitely. And one would also like to extend condolences, ongoing, tragically so, to the COVID victims as well, who are the numbers, as we see everyone, that the numbers are rising. Those who have lost a loved one. I think we are now at a stage where you either know of somebody who's passed on or somebody who's infected or affected by COVID. Basically, it affects everyone. Just before I continue further, a big thank you to the MEC of Health. Big thank you to Dr. Mudawa, head of health as well. There are so many people that played such an important role in the publication that it doesn't feel right that I'm the one actually on the spotlight here, when in actual fact, there are so many people that played such a critical role. Without them, this would not have been possible. My Vice Chancellor, Prof. Peterson, who promised me that he will be tuned in as well. and Dr. Molokome, our head of school, Prof. Mufolo. There are just so many. If I start naming names, it will be just too much. Prof. Glover, Prof. Motswaledi, there are just so many.
I was actually about to ask you because,
yes,
as I was trying to prepare for this interview, I picked up that you've got about 20 contributors. And we will talk about that, to the book, how you went about choosing those people.
Yes.
You've already mentioned one of them, Unoza, the Dean of the Faculty of Medicine at the UKZN.
Yes,
so we will talk about that, but you also mentioned that it's been accepted, your book has been accepted provincially, by the Department of Health, and it has been endorsed by the University of Free State as well.
Yes. So going back to your original question about what do I do, I'm one of those people who like to wear many hats. So I'm a senior lecturer, as you said initially when you introduced me at the University of the Free State. I'm also a consultant at Universitas Academic Hospital. I'm a proud father, a dad as well, but I'm also a non-executive director of a publishing company that has actually published the Atlas Brilliant Minds. So yes, I do many things. I'm one of those people that like to explore so many things because I feel like there are so many things that we can do as a human to advance sciences. Yes, sir.
But that is something that is unusual in our profession, Doc. When we pass matric, we've got a potential to basically do anything. All right. Normally, the guys who go and do medicine are what my former lecturer would say, the cream of the crop, at matric level, meaning they could have chosen engineering, medicine, actuarial science, or anything like that. Yes. And then they go and do medicine. And somehow society then expects us to just be limited to medicine, and as a result, some people discover other interests beyond medicine, and they don't explore them because we are put in this box. So you are actually trying to say, yes, I am a proud dermatologist, I'm a proud medic. However, I can get into publishing, and I can do other things that are actually close to my heart. And for that, for me, you are paving a way because not many of our colleagues do that.
Thank you very much, sir. And the idea through what I have achieved so far is really to also, it's a way of informing everyone to communicate, albeit non-verbally, that it actually is possible to do many things. We don't have to be confined to just one thing that you do as a person, Yes, so I think that was a very strong message that I hope it will continually go out there.
Yes. So Naga, what inspired you really to say, I want this book? I heard something about decolonized education, but I want to hear it from you. What really prompted you to say, this thing, it's now or never?
Yes, sir. The inspiration is basically through my journey, even before I graduated with my first degree, also done here at the University of Free State. The realization that my dermatology was not really where I wanted it to be. And it was through so many factors, but I remember I got hold of a book that was written by Prof. Glover and also Prof. Mossam. So it was a small atlas on dermatological conditions, and that book not only evoked my deep knowledge, something that I did not know within me, that I actually love dermatology that much, but it inspired me to not only specialize in dermatology, but to also find a way to say, hey, I can also do something like this, even maybe working with them. So it was really a need which I saw was missing. Even when I came back as a registrar, not much has changed in terms of uniformity of the curriculum. And my students were coming in, not all of them are seeing the same thing at any given day. So it was really to try and say, let's have uniformity, but also on a second layer would be to decolonize as well. When we say decolonization, as I said on my previous interviews, it's not so much against the Caucasian race in any way. Decolonizing means that to have homebrewed local content, us as academics telling our own story from our own perspective as academics in our own right.
So basically,
so that was
indigenizing, medicine to make it relevant to the African continent.
To our local African continent as much as possible, say. And what better way of doing so than coming up with a novel concept of actually also unifying different aspects of, because what I like about the atlas is not just atlas in dermatology, it's actually an atlas where a dermatologist has got a platform to work with an endocrinologist, with a rheumatologist, with forensic medicine, ophthalmology, you name so many facets of dermatology, and to show GPs and then medical students that dermatology is but a spectrum of a continuum of the medical spectrum, if you will. Yeah, so that's why, yes, sir.
Yes, and how has it been received? I know that it has been a soft launch. It hasn't been properly launched yet because of COVID-19, but the students are already having access to, the book. So how has it been received so far?
We've been getting a lot of good comments, good appraisals for the book. It's officially now being endorsed by the University of the Free State, as per the meeting we've had with Prof. Mofolo. Also, the Free State Provincial Department, they've long endorsed it. The students are loving it as a platform. Some of them are starting to have it. We hope it will be part of the curriculum. It's just small nitty-gritties to get it to become curriculum for the University of Free State, but also as an additional book for other neighboring universities as well in the whole spectrum of medicine in the Southern African region. Yes, sir.
So, Doc, when you say this is a book about African skin conditions, we are in a country where sometimes people don't understand certain things. So, when you say an African, it takes us back. Who is an African? Are we talking the indigenous peoples of the African continent, or are we talking anybody who lives within the African continent? Just to clear that part. When you say this is about African skin conditions,
when we say African, it was in a perspective coming from Africa as a continent. So there would be a chapter. I mean, it doesn't just include the brown African skin, but there will be Caucasians, there will be a bit of Chinese, Indians. So, but of course, in a country where 80% plus is Africans by race, the book also reflects that, but it's not really in any way excluding a certain race. So we'll have Caucasians.
It's actually an inclusive book.
It's an inclusive,
for all people who live under the African sun.
Yes, and that is also reflected by the contributors as well. It's not just Africans by race who contributed, but also other races as well. Yes.
No, because this part about who is an African is always a touchy, subject. So you're basically anybody who lives under the African sun who's got a skin problem. That book will be a guide to to them being helped by an appropriate professional anywhere in the continent, basically.
That's correct.
Yes. So Doc, obviously we now know that the book is there, but this journey, how long did it take you from the concept to the point where you say the book is now a finished product?
I would say it took about 4 years, give or take a few months more, but roughly 4 years, because initially I first had to conceptualize it. And then as time went by, I had to get ethical approval from our university to take photos of the patients. Also, the patient had to sign consent form. It's a bit different when you publish something. Of course, you always need to get a permission from the patient, but when you are going to do so for publication purposes, it's absolutely key that you have a designated piece of paper that they can sign and understand in their own language. So that process in itself took a long time, because then every patient coming into the clinic, as they come, you kind of like see. Yeah, so it was quite a lot of many. Also, we needed to get permission from the head of health, Dr. Mutau, who generously gave. So it was quite a multifaceted process, in that ethics had to come in, provincial office had to come in, but also we also had to have a legal side of the university coming in and actually playing a part in approving such a project to actually take place. Many thanks to Prof. Mofolo for leading that role. The biggest challenge was at the academic front, which I'd like to think of it as a fourth wheel of the project. It was ethics legislation.
Just before you get there, Doc, before you get there, the issue of ethical approvals. I know when it comes to like master's research, PhD research, that's normally a very, very difficult part. And in an academic world, people really look they look for everything, before they can give you that ethical approval. So how difficult was it to get this ethical approval? How many times was it spent to and fro?
Extremely. The biggest problem was that this was the first time they actually would approve for a book, because in my ethics department, they've never actually had approval documents for a book. It's always about masters. It's a study. So they actually had to design some framework for me to have a leeway. So you can imagine, before we can even go anywhere, we first have to jump that hurdle, which was really, really a struggle, But we're happy eventually everything got done. They understood the principle of what I was trying to achieve, and very, very helpful as well at the ethical. So that was a big hurdle. That is correct, definitely. But I'm very happy that we did pass that, sir.
Yeah. And so, Doc, you were just mentioning that the academic side of things was the most difficult. Just expand on that.
Yes, to sit in with a dietitian and tell them that you actually wish to collaborate with them, have a book that has got some dermatological skin conditions, but you also need the input of a dietitian in that as a contributor, and then go over to ophthalmology as well. And sometimes you speak into people who are much more senior than you, who haven't even done something like that. And to have those people entrust you with their time and content that you would actually do, even though a lot of them, to be honest, they kind of didn't understand what I was trying to do, but they still entrusted me to actually continue with the process. So that was a very, very difficult. Some of them are even in other offices, Pretoria, your ophthalmology, Prof. Mokunyani, it's in Pretoria. So we had a lot of people that we worked with in this project, but it will be on this digital stuff, email back and forth, trying to make them understand. So to have, and the contributors were many. I think we had about 30 contributors, not including peer reviewers. So there was definitely quite a lot of them as well. Some of them non-academic contributors as well. Yeah, so the academic side was actually, that much more difficult and challenging.
Yes. Now, let me just take a detour a little bit.
Yes.
When I qualified as a doctor in 1989, I went and became internship 1 year, another 5 years as a GP, and I told myself that in 5 years I need to go back and specialize in something. And I actually chose to specialize in dermatology.
Mm.
And I went back to my university, University of Natal, where I had qualified, to say, guys, I want to do them. And they told me, look, we only train 2 at a time. All right. So they've just started. The only vacancies that will appear will be after these 2 have passed in 4 years' time. And one of those was Moza, you know,
Wow.
Dr. Nova.
Yeah.
Dr. Nova. So, Professor Abu Baker was actually the head of department of dermatology at the time. So Moza and another, a colleague had just started. So I was like, okay, I can't wait 4 years. Let me put my name on the waiting list. Hope that when Moza passes, then I'll come in. But in the meantime, let me do family medicine. So which had just been introduced in Natal. And so that's what I did whilst waiting for them. I finished that, and I got a call when Moza passed that, hey, come, we've got a space for you. Well, I had made friends with Dr. Abu Baker. Each
Okay,
time I
that
went for
explains
my
things.
blog things, I would go buy them cakes and
Great,
nice
great
things
stuff.
in the department, and somehow, I managed to be up there. But unfortunately, by the time they called me, I had already decided I want to mix medicine and business. So I wanted to do an MBA now with medicine and see what comes up. And so I unfortunately had to say to the guys, Ish, I've already committed myself to a different route. So please give this to another deserving, a
Yes.
person,
Mm.
But there's that part of me, that is still into liking the field of dermatology. And so that's
Yeah.
why when I just heard about you, I thought somehow, this is the space that I love, and I'll definitely enjoy this interview. But anyway, Doc, so
Amazing.
you went through all those hurdles, but one thing I like though with you is that forced by the circumstances to collaborate,
Mm.
it brings back the originality of medicine, which was not compartmentalized. You know, when I was doing family medicine, one of the things that was said was that with more and more specialization, we are losing the integrated approach, of seeing a person as a whole. Because one piece of must go there, the other piece must go there. So in writing this book, you had to actually forced by circumstances to have an integrated approach.
Yes,
And for the
that is
students,
absolutely.
they will definitely benefit from that, because then
Yes.
they are hearing, like you said, endocrinologist, describing a dermatological condition. What other, challenges did you get, or go through, in your journey?
Others, funny you say that. I think you said you graduated in 1989.
Yes,
I don't know
yes,
if I
yes,
got that correctly.
yes.
Funny, at that time I wasn't even in sub A, so it just goes to
Ah,
show. Because I
okay.
started my sub A in 1990.
Okay, Doc. Now that
Yeah.
reveals my age badly. Yeah,
Yeah, other challenges that we went through. Yes, to keep time,
yeah,
to be able to keep time, to have time, and remember, I'm non-executive of the publishing company, so I still
yeah,
have to report to the directorship.
yeah,
And then once we have collected all the manuscript in total, we
yeah,
then had to go over to the editing part of things. So then you have to get somebody to do the grammar and check all the typos and such.
yeah,
Cost is a very huge factor as well, because if you get somebody who is affordable, but they are not really the most respected in the market, in terms
yeah,
of that. And to have something of this nature, this such a book, you now not only need to get a editor, but you need to get a medical editor, which
yes,
makes it much more difficult. You want somebody who's familiar with the medical language. So I
yes,
worked with Dr. Chico Roro, and also our head of library at our university here,
yes,
Ms. Dupreez. So that
yes,
was a big factor. Then after that, we still have to take the process through over to graphics. So now graphics has to put everything, lay out everything, check all the quality of the photos. It's good that you have the photos, but now you have to look into issues of changing the background, the angle here, you know, how will it come out in a book once it's printed? Because it looks good on a tablet, you know, for example, but once you print it, what will be the quality of that? So those are some of the challenges that you still need to, and be sure that you are still within the legislative framework and within the permits of a publication rules and regulation. So many hurdles, but I mean, one learns as we go along, you know, because now we have the actual end product, and one is very grateful that finally, you know, it came out the way it did.
So, Doc, this publishing company that you are part of,
yes,
is this the first book that they are publishing, or there's other books that they are publishing in other fields, or within the same field of medicine?
This will be their fourth publication, but all of them were publications that I actually, this is my fourth book actually. So that means that I actually wrote a book in short stories. My first two books were short stories. Again, going into the market, your exclusive, your bargain books, really looking for African literature and finding that our stories are not as celebrated, you know. So then I started putting paper to pen and actually writing. So the third book was actually a Sotho book. Again, realizing I went to our Sotho museum here, the Free State, and there's a shortage of literature and content. So my third book was actually a translation of one of my English short stories into Sotho. And then I thought maybe I should really go into the line of academics with that knowledge of publication and everything. But of course, I had to relinquish the prominent position and just take the author route and also the non-director and answer to directorship, so as to not to have conflict of interest and whatnot. So this was actually my the fourth project. But what's more interesting is the future. We are working on
I was about to ask you about that, to say now you've got a medical academic book under your belt. This can't be the last time. What's in the pipeline, Doc? But maybe let's not talk about that. Let's talk about that towards the end.
Okay.
Can you show us?
Save the best for last.
Can you show us these books? Do you have them nearby you now? So just to show people, these are my books.
Okay. They are also available. Yes. Should I start with the atlas?
Show us the atlas. You know, just a little bit of pictures from there.
Okay, this will be the atlas. I don't know if it projects
I can see it here.
But this is the skin atlas. And then this will be the publisher then, publication body. So anybody interested, you just go over online, brilliantminds.co.za. It's got all the books that we have done and books that we're going to be doing in the future.
Doc, not so quickly, Doc.
Okay.
Just show us a few pictures, like maybe a skin condition, this, whatever. Just for people to have a sense of what is contained there.
Okay, sir, no problem.
Just pick up any psoriasis or alopecia, or
maybe what I can do for you, I can just maybe take you through one or two highlights. We worked with Childline SA. They gave us all the stats with the one of the chapters will be cutaneous manifestation in child abuse. Lupus Foundation, the HIV Clinician Society. We worked with albinism and also Institute of Dermatology. So these are the chapters. It's got 36 chapters. And then we've got the foreword by our wonderful Vice Chancellor, Prof. Peterson, our Vice Chancellor at the University of the Free State. And then the first section, we divided into sections. So the first section, section A, would be more introductory.
I don't know, it's just the angle.
So this is the introductory. So the introductory is actually going back to the cellular level, functions of the skin,
Yes, as the
apocrine
biggest
glands.
organ of the body.
Yes, yes, that's how we start the first paragraph. The first word says that, you know, we are the custodians of the biggest organ in the body. So this would be your papules, vesicles, you know, just to
Yeah.
describe. This is
Yeah.
more at according to me, it's at a third year level. This is what I would
Yes.
like for our third years to be learning.
Yeah.
What's an erosion, what's a comedo, what's
Yeah.
a tumor,
Yeah.
and all of that. So the second chapter, okay, before I go there,
Yeah.
I'm going to go over, this is some of the procedures that we do in dermatology. This is somebody with
Yes.
Hex disease.
Yeah.
This is a procedure I did myself.
Yeah.
So derma has got a bit of surgical element to it as well. You know, cryo, punch biopsy. Some of our students don't get to see what punch biopsies look like. So I thought
Yeah.
maybe I should take the
Show
courtesy of doing
them
that.
there. Yes.
Yes, punch biopsy, there we go. And then the second chapter was actually benign stuff. I thought it was so important to include all the benign things because we get so many referrals from GPs, and then the patient comes from very far only to bring something that is absolutely benign.
Yeah.
So
You
what do
see,
you
Doc,
do as a
now,
GP?
because some of our viewers are non-medical, just benign, what it means.
Benign means that it's a growth. For example, this would be a keloid. When we say something is benign, it actually means that it's non-malignant. It's not cancerous.
Yeah, it's not cancerous.
Yes.
It is there, but it doesn't cause cancer.
It
Yeah.
is there, but it doesn't. Yet it's a growth.
Non-cancerous.
Yes, it's
Yeah.
a growth that is not cancerous.
Yes.
This would be a keloid, for example. Common stuff.
Remember keloid, because people don't know keloid.
Okay.
Just show us. Normally have them there by the ears.
Yes, this would be a keloid. Keloid in the ear. This is a lady that actually underwent about 5-6 surgical excision. So the more you excise it, the quicker it comes back again, keloid. So, you know, just to make the public aware and medical doctors aware of keloids. Of course, there are ways of treating it. Part of my master's was to treat keloids, actually.
Yes.
And then as we move on, so we've got pigmentary disorders. This will be your pigmentary disorders.
Yes.
I don't know if it comes out nicely, but pigmentary disorders.
Choose another picture that will show proper contrast.
Okay.
So basically, issues that have to do with pigment formation, either too much or too little.
There we go, sir. Yes. This will be your sun-induced problems, sun-induced dermatitis, chronic actinic dermatitis, your photodermatitis, as we call it. Yes, there are just so many. It doesn't always.
Yeah.
It doesn't always come out as nicely, you know.
Yes, no, but I can see from here. Anything about acne, people are very aware about issues that have to do with acne. Those are normally the commonest reasons why people would come to a GP, you know.
Let's see if I can. Oh, there we go. Acne, for example, this will be okay. Ideally, at a specialist level, you're gonna see the worst type of acne. So this will be acne conglobata.
Yes.
Or conglobate acne. So it's a widespread acne, typically worse at the back and chest area than on the face. This would be your acne fulminans. Here on this side, acne fulminans. I don't know if you can see this nicely. This is a typical acne that we typically see at the GP level. Grade 2, grade 3 type of acne, inflammatory. And then you also get scarring type of acne. This would be a scarring, hypertrophic scars. It resolves with hypertrophic scarring. So there are different types of acne, and at a student level, it's always good when you graduate that you know which acne can you treat, and then which acne should actually be referred over to a specialist.
Yeah, and in fact, again, from my family physician or family medicine training, they say a specialist in any field is somebody who knows more about complicated or unusual cases in that particular field. Meaning, the majority of things should be the common things that a competent GP should be able to deal with. but they must know that this one is complicated. This
Yes.
one it's unusual. I should not touch it. I must refer.
That is absolutely correct. I think, in a nutshell, that is what this publication wanted to achieve, to say, where do we draw a demarcation line between what's specialist and what's GP?
Yeah.
And then just to give a brief overview. And it's also good to, as a GP, to also know what is it that a specialist is going to do once the patient gets there. So it
Yes.
also dives deeper into what we do in dermatology on a day-to-day basis,
Yes. Yes.
Yes,
Yes.
sir.
So, Doc, I'm just gonna. I think this one. I thought I was going to ask you about it even before our interview, to just tell us, we are in the middle of the COVID-19. All right.
Yes, sir.
Surely, when you were writing this book, COVID-19 was not there. It's only been 6 months that we've known about it since China, but we are also learning as the medical profession, and we are hearing that there are some skin manifestations of COVID-19. They may not be there in that book, but can you just share quickly what kind of things that people that have either gone through, they've recovered, but they are left with something, or some manifestations that may be, because we initially we thought this is largely a respiratory type of disease.
Yes.
But
Yes.
now, as the weeks and the months are passing, the presentations are not the typical just respiratory stuff. Other people are presenting with a lot of GIT stuff. Other people are presenting with neurological stuff, loss of taste or loss of smell, and I'm sure even in the dermatology space, there must be some manifestations.
Yes, definitely, sir. I think the focus with the country is more on respiratory, to make their diagnosis, loss of smell, diarrhea in the GIT space, coughing, fever. So we don't really, dermatology would not be a discipline where diagnosis is being made.
No. But stuff that has been described, though.
But what has been described with the current literature that's coming out now, and a lot of it comes from the European articles. Of course, at a specialist level, one must keep abreast with what's coming out. So there was actually an article I was reading a few months back. So then what they did there was quite a brilliant article that was written there. Cutaneous manifestations of COVID, urticaria, the hives. Typically, a lot of patients with COVID, they tend to have hives. There's what we call a mobiliform rash, very fine maculopapular rash. Of course, more pronounced in the Caucasian or lighter skinned people than it is in the African skin because of the darker skin tone, so it doesn't manifest as clearly. And then other issues, which was the bulk of the article, was actually not so much on the cutaneous manifestations, but actually the sequel of COVID. So people wearing masks, for example, they'll have contact dermatitis, they'll have exacerbation of periorbital dermatitis. Somebody who has always had a periorbital dermatitis would actually now become worse because they have to wear this mask the whole time. The stress that COVID has.
Perioral or periobital?
Sorry, perioral. Sorry, sir.
Perioral.
Perioral dermatitis, yes, because of the mask. And then the other component that was actually quite important as well was stress related, because this is a very scary, am I going to contract it? What's going to happen to me, my family? Kids can't go to school, whatnot. So that also worsens some of the dermatoses that are also known to be exacerbated by stress. That would be your seborrheic dermatitis, your acne can be exacerbated by stress, but also your psoriasis. There's a condition called psoriasis. We know one of the trigger factors is stress related. Amongst other, HIV is there and other drugs, but stress is also one of the key. So it's not just about the COVID, but what the COVID comes with. The other components, just to finish off, is the lack of access to treatment and specialist care. Our numbers, even at our clinic, have dropped significantly people are not even wanting to come out because they don't come for their refill and prescriptions. So as a result, even common bullous vesicular dermatosis now become worse as a indirect result of COVID. So when you look at COVID in a bigger spectrum, don't just look at it on the virus, cutaneous, look at it in totality.
Yes. And obviously, the other area, I mean, I came across an article that was talking about an increase in the number of people who are presenting with rash on their hands because of the, reaction to the sanitizers.
Yes, I have also contact dermatitis of the hands, and you just reminded me that also one of the common presentation, although more in Europe, was the acral or the skin that undergoes cyanosis. There's paleness and blue discolorization of the toes and also the hands. So that's also one of the key features of, I think it's because of the vasculitis part of the COVID that
affecting the capillaries,
affecting the small capillaries. Yes, sir.
Yes, yeah. And so, Doc, what you just mentioned now about the fact that your patients, long-term patients as derma, they have not been coming. It's something that was described also by the MEC here, but he was talking around HIV patients who have, defaulted on their treatment, who have defaulted on their treatment for months, which obviously brings in a worry about resistance and stuff like that. So these guys who maybe have been well controlled under your derma treatment and now have defaulted because of maybe fear to go out, to get to hospitals and stuff like that. Any consequences that are negative that might be related to them not being able to present themselves to you guys?
I think the consequence is that at some point, I suspect that there's gonna be a burden that comes as a sequel of COVID, that suddenly once everything is open again, that we're gonna have this patient coming in, some of them more complicated, something that was well controlled, suddenly is a condition that suddenly it's been 3, 6, 8 months, depending on the nature of the condition, suddenly coming in with complications. I do suspect that we can expect a lot of considerable morbidity and mortality as well, indirectly as a result of the COVID pandemic. Yes, sir.
Okay. So, Doc, like you said, the numbers, have gone down. Now, your units, or maybe wards, your derma wards, have they had to be given out to be able to look or to accommodate COVID patients and stuff?
Yes, of course, in derma, our bed occupancy is relatively low when you consider it with regard to the whole hospital, because our emergencies are not so many, because we will see your toxic epidermal necrolysis, which is a drug reaction, your DRESS syndrome. So that was never really a big issue because our bed occupancy has never, but yes, definitely. Not only did we have to allocate space, but we also had to allocate doctors to go and help out and have us consultants actually on the floor working while we give our registrars time to actually go into the COVID. There might even come time when we as consultants have to also go in and assist, depending on the numbers and such. Yes, so definitely the impact of COVID has been quite considerable on the staff, the morale. Everything is just very suspect. Everyone is suspecting. Nobody wants to be. So the COVID has actually come with its own set of problems.
And how has it affected undergrad or even postgrad, teaching?
Well, postgrad at a master's level, one has to navigate their own terrain, because at a master's level, it has to be individualized teaching more than anything else. At least that's how I had it. But certainly it has also had some good impact in that it has provided space for online, the Zooms, the online teaching. So it has actually given us a chance to actually open other channels of communication. As a professor, I have a lot of respect for Prof. Grayson, a renowned histopathologist, dermatopathologist, and he has been helping some of our registrars with histopathology online. And such, not that COVID, they wouldn't have happened, but definitely COVID helped secure things in that way.
And there's even more acceptance of these webinars now.
Webinars,
there are no alternatives, really.
Yes, and then those are kind of things, your webinars, your Zooms, they are here to stay. Even after COVID, everybody's like, yeah, but can we not do a Zoom? It's made things easier for access to communication. But certainly when it comes to the pre-grad, those are the group that I think are more hit, because they have to come to the clinic, see patients, see pathology. So we had to lock everything down. Our medical students are since back now, so everything is much better. But you'll hear of a case of a break, positive case here, so that really dampens the mood and creates a lot of panic and uncertainty moving forward. But as we know, medical doctors. Yes, sir.
Now back to your field. Again, I'm talking as a family physician now.
Yes,
we were told that, when a patient presents with any illness, even dermatological, problems, there will always be a psychological component, which one must also don't just focus on the physical, but also we must be mindful of the psychology. That is now as family physicians, that biopsychosocial approach.
Yes, holistic.
Now, we also are aware that with this pandemic, there's been moderate to severe psychological impact. I mean, a study in China showed that. In the US, the same. And the study by SADC has also showed that, just the pandemic on its own is actually stressing people, a lot of anxiety, some people with pre-existing mental problems. So I'm saying, I'm actually bringing the point to say, saying that some people, like, they've got maybe bad acne or bad, stuff on their face, it does affect them psychologically. Now, maybe they have not been able to keep up with their treatment. And there's also the psychological impact of COVID. So if you add that, you are I'm postulating, you are likely to see your patients coming 3 months or 4 months down the line with the problem having worsened, maybe, but also there's the side of their psyche, where it might need some attention from, either psychologists or even psychiatrists.
Yes, even more so because some of these patients would have lost a loved one, but also they would have even lost their jobs, as a result of the COVID. So that would have added a lot of significant impact to the stress-wise. So definitely, so I think we are heading for an uncertainty moving forward with this COVID and what's going to happen in future as well,
Yeah. So, Doc, back to your book. This really was about your book, but I was opportunistic there just to get a sense of how things are going in the hospital. Now, this beautiful book, I also want to have one. So you just need to tell me where to go to get it. It will be a coffee table book here in my office. All right. And maybe I might just buy a few and give them as gifts to some of my GP friends, and stuff. But besides the medical people, who else can benefit from this book? When I say besides the medical doctors, like in the nursing profession, can they benefit, from having this kind of book?
Definitely, sir. We have a big problem here in Deb. I always, whenever I send emails to my seniors and managers, I always say that our dermatology, our nursing don't do a lot of dermatology. And as a result of that, our clinic is flooded at an academic level with really basic stuff that even a nurse could have diagnosed. So funny you say that a good 70, 80% of skin conditions included in this book were actually referral from doctors, but largely even nurses from the peripheral clinic. So
At
the
primary
idea
healthcare
is to,
level.
at a primary healthcare level. So the idea is really to take dermatology down. That's the basis of my appointment as a consultant. I go around the Free State to actually educate some of our nurses and doctors about basic conditions, non-emergency, emergency. So I basically look at what is it that I'm getting more of, and how can and what do I get late referrals of as well. So my task is actually to go out there as well. But I absolutely think this is a manual that even nurses would definitely benefit from, sir. Absolutely.
Yeah.
So it's actually targeted doctors, but also nurses as well.
Yeah. So, what is the damage, doc? When I say damage, the cost.
The cost.
How does
Yes.
you see now? I'm asking you, and I'm putting you on the spot. They
Yes.
normally say we medical people, we always eager to talk about patients and everything and what we do. But when you then ask rands and cents, we generally don't like talking rands and cents. But I'm gonna
Yes.
put you on
Yes.
the spot.
Of course.
What
Of
is the
course.
cost of this book?
Yes. Can I give you an indirect answer first? It's always easier to put a clear perspective that as an employee at the university, I'm absolutely prohibited from directly benefiting from any proceeds from this book. So our agreement with the university legally so was that proceeds of this book actually would go into the university. The publisher would obviously get the publication expenses. But any proceeds that were made, the book was never really to commodify or to make money. It's not a money, it's not a business opportunity, but it's really to give a platform whereby diseases can be managed that much better. So our biggest cost was actually printing. To print 1,000 plus pages on high resolution, it cost around 1,000 9, depending on how many books you are going to print out, of course. So the book goes out for 1,250, but of that amount, the printing by far, our biggest challenge is the printing.
The biggest cost is.
Yes, the biggest cost. So we are hoping to sell in hundreds, thousands, because then knowledge is out there, but any proceeds that are made will then be propelled towards other publications as well. So this is really a platform like yours, what you are doing here. This is really a platform for academics to come in and say, I've always wanted to write such a book, whether it's a short story, it's a novel here. We've always wanted to go into academic space. So we really need as many people buying, not so much for profit making, but to propel the idea moving forward. And actually would like, if you can buy 5, anybody buy 10, because then those books that you buy, even if you keep them with us, we then identify students that are less privileged, who maybe don't even have bursaries, and then we give them to them. We make a difference, so the idea about around the Brilliant Minds as a company was never really about profit. It was about providing books that are sustainable, well researched, high quality, but actually as a continuum. So we would love to have 100 books in 5 years, 10, 50 years maybe, and celebrate something of sorts. So so it goes for 1,250. You can get it online at Brilliant Minds, www.brilliantminds.co.za, and then you just follow a link. It's also courier inclusive. And I see a lot of colleagues of mine saying they want free copies. They don't understand. Even if I give you, no, not you.
You must not do that, Doc. I mean, this is there's a lot of sweat behind that product, and in fact, 1.2 is not that expensive for what I see in there.
Yes.
You know, it's
Yes, sir.
actually a very, very reasonable for an atlas of skin conditions with the content that is describing those things
Yes, sir.
and the number of professionals that had contributed. Really, I
Yes.
mean, it's actually a very reasonable price. I would have
No,
expected
thank
it
you.
to be more. Now,
Thank
you
you so
should
much, sir.
not give that book, because by giving it for free, you are actually cheapening it. You know,
Uh,
quality, people must be able to pay for quality. So freebies, don't give freebies to anybody.
yes, yes,
My brother came up with a book last year, but he's more on the management side, Mr. Mteto Nyati. So the book, his book is called Betting on a Ducky. You know, I think it's one of the top selling books in South Africa at this moment, since he launched in September. But I also told him, I'm your brother, but I don't want a freebie.
yes,
I must appreciate your book enough for me to take out money from my pocket to go and buy it.
yes,
So you must not be apologetic about it, Doc. People must buy that book. It's a
yes,
product of sweat of so many people, and we really need to get used to the idea that if we must value
yes,
our products, we must value the products of our colleagues. We must not go and ask for freebies. If you can't afford
yes.
it now, plan for it, but
Later
don't,
on,
so really don't
yes.
do that, Doc. It
No,
will be
thank you.
cheap product.
Thank you. And also, because I will not directly financially benefit, the
Yeah,
proceeds that we make will really go into, propelling the idea. I'd like to publish. I'm more behind the scenes
yeah,
publishing. I like that.
yeah.
That's really one of my passions besides being a doctor. So the idea here was never really about money, although money is an important factor in
Yes,
publication. I mean, if you
yes,
want quality editors, quality graphics,
yeah.
you have to, it's important to have that. So
Look, there were costs that were incurred by your publisher,
yes, yes,
to bring this book to life, and they need. You see, it may not necessarily be a profit-driven thing, but you need to recover those
yes,
costs
yes,
and have a
so
little
that we
bit
can
left,
move. Yes,
so that you can actually be able to do more.
would
You
love
know,
that, definitely, sir.
exactly. So for me, this is exactly what I said earlier, to say, as medical people, sometimes we feel a bit uncomfortable talking money.
Yes, yes,
And, but I remember when I was in medical school, if you dare utter the word that you're going to go into private practice, you know, you are like seen as somebody who is going to abuse the investment by government on you. But the reality is that people go up and become GPs. Others, they study like you, they go out and become specialists, and actually have to run their practices as businesses. So there's nothing wrong in actually having a profitable venture, as long as you did not steal.
yes, yes,
Yeah. So there's nothing wrong with that. So those publishers must not be apologetic about making, because it needs to be a sustainable business. If it's
yes,
loss making, it doesn't get returns on the investment
yes.
in bringing
Then
this
we
book
don't,
up,
we don't, we
then you
don't
won't be
write
able
more.
to
Yes,
actually showcase more
yes.
people going forward.
Yes,
So
and we absolutely, just adding on that, we also need a second edition of the same book in the next few years again. So,
yeah, I was about to ask, what
yes.
next? I
Okay,
was about to
what
ask what
next?
next.
Yes,
Yeah.
yes. What next is that we're working on a histopathology book, dermatopathology. So we've got a few professors from different universities coming in from Pretoria. We've got Prof. Bida, led by Prof. Wayne Grayson. Prof. Schneider is also coming in into the floor, our very own Prof. Hudals. So we're going to have a histopathology book. This will be one of the first books to be published for postgrad content or
Yeah.
consumption rather.
Yes.
So that is
Yes.
extremely exciting. We're working on an ophthalmology book as well. which is also going to be for pre-grad. So and then I also have my own personal book that I'm gonna be working on with my wife. It's Nurtured Skin. You'll see when you visit our website. This is actually when a conversation. I've been married 15 years now. So after some time, 15 years down the line, you kind of like, okay, baby, I'm a dermatologist, you are a chef. You know, the kind of conversations a dermatologist and a chef would have. So we're actually going to put that in a book and say,
beautiful.
skin
related. How do you make sure you feed your body in a way that your skin actually
there
shows?
We go. That's the concept. Yeah, that's the concept, sir. So we've got a lot of exciting projects to come in the Brilliant Mind. So we need as much support as we can possibly get, sir. Definitely. This is not so much about money, but it is about us writing our own stories and having the platform to do so. You've given me a platform now to speak about the book. I'm doing more or less the same thing. When I say an academic, you are a writer in your own right, write your own story. I will publish for you, but it needs to be a well-oiled machine that's got resources and so that the quality, the end product quality is actually of a certain standard. You know, that's actually extremely important.
No, I'm definitely happy. Now, Doc, being a book that is for the African continent, we know that when we look at this continent, you've got Anglophone countries.
Yes, sir.
Obviously, the book must be, in English. But then we've got Francophone countries. We've got a few Portuguese speaking, like Mozambique, our neighbor, Abos Bali, and also Angola. So are you thinking of a possibility of this being translated, especially like to French, because more French speaking people in the continent than English speaking people, so that this book really becomes a continental or a continent-wide book? So the content is the same. It's more an issue of translation.
Yes. Sir, we haven't, I personally, with my team of directors that I report to, we haven't really thought that
if you had an approach from a Francophone university or somebody, a colleague of yours at Derma, would you be open to somebody helping you to translate the book?
Absolutely. But our immediate plan now is we are in talks, or rather the directors are in talks with Nigeria, Zambia. I'm also personally in talks with the Dean, Prof. Masira. We've just communicated earlier on as well. She's also tuning in, hopefully. So the idea is to take the concept out into African English-speaking countries first, see how much revenue we have
for you at this moment.
Yes. So once we have enough revenue and we have enough muscle, definitely the sky's the limit. Why not? Even take it to European countries. To give them a sense of African perspective, African flavor. This is how we see things. That's actually quite important, I think, as well.
And also, though, being at UFS, which is historically it's been a very African, environment. Isn't there, a thinking around, or people who feel, is there a possibility that this thing can be translated into Afrikaans? Any of the colleagues there who are African speaking? Well, some of your students, I'm sure, they are African speaking, unless now it's a dual medium and therefore they are comfortable with English as well.
We've actually, I think I stand corrected. Prof. Peterson would excuse me on this one, but I think Afrikaans was done away quite recently, UOFS and Stellenbosch. I know from the newspapers that it's not the case with UNISA. They actually lost the case to do away with Afrikaans. So even with our lectures, we're now giving strictly in English. So I wouldn't mind translating. It's not an issue for me to have an Afrikaans book. The issue would be more on the publishing side, the cost-wise versus the target market, the printing. Because remember,
there must be a case for it.
Yes.
There must be
so if the demand is
there must be a demand.
Yes, if the demand is there, and definitely, I mean, why not? Language should never be a barrier, be it English or Afrikaans or Sotho
Well,
for
the
that matter.
content is the same.
The
It's
content is
just,
the same.
the language that you are using.
Yes,
All right,
absolutely.
Doc. What else would you want to share that's up your sleeve?
Okay, what I wanted to share would be that I'm very grateful to have published this book. For me, it was a huge milestone. Very many hurdles that I had to jump through. The support that I've received from everybody who has been part of this project was overwhelming, you know.
Yeah.
And what I like about this atlas is that it unified the university to some extent in the medical fraternity, and it brought us closer as a fraternity working together, and it brought a sense of pride and honor, and you know, that idea that I as a contributor have contributed to a book. Actually, it is possible. So the most wonderful thing that has happened is that I suspect that I've unleashed the writing in some of my academic colleagues, yes. So that I'm very happy with that, you know, and that actually propels them to say, what else can we do, you know? How can we take this? So my idea is 5 years down the line, 10 years down the line, we should look back at where we started and actually celebrate and say, wow, look how far we've come, you know, and it's only through unity and working together and support as well from everyone that we can actually achieve such.
No, thank you very much, Doc. You know, for me, obviously, I told you now about my love for Derma.
Yes, yes.
You know, and I will certainly be placing an order. I will take a picture and send it to you once I've got the book. So I don't want you
Great.
to send me a book,
Oh,
please.
that's
I don't want
great.
I don't want that. I don't like freebies. So I will get the book, and I will also look and see how I can be able to just maybe buy a few more, and decide who I must give it to. But thank you very much for your time. This is family time. You know, doctors are normally very busy at this time. So to steal you for an hour and some minutes from your family time, you know, it's a great honor. And so I'm really, really, really thankful. And today being Mandela Day, I wanted this interview to be 67 minutes, and we are exactly at that 67
That's
minutes
great.
now.
Great.
Somebody who's been listening has, benefited something out of our 67 minutes of conversation. And
Yes.
so I want to thank all our viewers who connected via the multiple social media platforms. I want to thank your friends and colleagues, Doc, that have used the various links that I provided to you to be able to follow this conversation. And in Sutu, there's something about, what do they say now? Pula.
Pula.
Then,
Nala.
yeah, yes, aine, you know.
Thank you
So
so much,
may
sir.
you have more and more blessings, Doc. More books being published, more people being inspired by what you have done. And really, like you said, let's publish our own stories, because if we don't, others will write, but they will never give it that authentic thing. You know,
Yes.
there was a gentleman who used to be a COO at SABC. We used to talk about that thing. He comes from your province,
Yeah,
so
yeah.
if you are
Felt.
not authentic, it won't have that thing. So
Yeah, that's
please, man, continue to do great work. I look forward to another book, but all the best for the future. And I think I must thank the university for actually not standing in your way, but actually supporting you,
yes.
because not
Yes.
everybody get that kind of support. So they've done a great job, and may they continue to do that type of support, not only for you, but for others who've got innovative ideas. Thank you, Doc, and
Thank you, sir.
hope to meet you in person in the near future, post-COVID, if
Thank you
there
so
is
much.
something called post-COVID,
Yeah,
but
that's true. Yeah.
to see you. Thank you to everybody who joined Dr. Lehlohonolo or Dr. Blessing